Doctors are seeing an explosion of baby boomers coming in with injuries from exercise. It is known as Boomeritis. Dr. Riley Williams is an orthopedic surgeon who practices sports medicine. Welcome.
Thank you for having me.
What's the problem here?
Well, you know, it's a controversial term. I don't really consider boomeritis to be a big problem. You have to understand that this generation of individuals, 45 and up, have been bred on the idea that exercise is going to not only maybe lengthen your life, but really increase your quality of life, and thus they've been exercising their whole lives. As you get older, joints, ligaments, and tendons, they change, as we all know, and you're going to have some injuries from time to time if you continue to exercise vigorously.
Even though you stretch and even though you do a lot of things so that your joints are...
That's right, even though you stretch and do all these wonderful preparatory things that we've all been schooled in.
You say one of the biggest problems that seniors have, this boomeritis, is ignoring a lot of these pains that they have, right?
That's right, that's right. Like I said, you know, I always in my office stress that I'd rather have a problem with my limbs as opposed to problems with my core, diabetes, heart disease, and things. So as we know, vigorous exercise is a healthful approach. However, we start to have a certain type of commitment to our exercise, and we ignore these normal signs that may warn us that something's coming about.
You also argue that it ought to be a diversity of exercise.
That's right, diversity of exercise. You stole my term. So. But again, take running, for example. I see a lot of 5-day-a-week runners, and it's almost virtually impossible after a certain age to continue with that frequency. So I encourage people to do other things, biking, intense gym training, things that may give you that high that we've heard about. It's associated with running exclusively.
So we've been hearing a lot about joint replacements, more common and good idea?
Yeah, you know, joint replacements outside of certain heart procedures have been determined to be one of the most positive things in terms of enhancing one's quality of life, certainly north of the age of 50. So as a result, you see people looking at themselves and saying, you know, I'm not quite as fit and able to do some things because of pains in my hips and my joints. So there seems to be a little bit more openness to having these joint replacements earlier in life.
Are boomers healthier? Are they exercising more?
Of course we are.
They're healthier, but I think it's quite frankly, it's a better quality of life through exercise, and these joint replacements facilitate that.
All right. So nice to meet you, Dr. Riley Williams.
Again, thanks for having me.